So we're going to discuss today the need and the overview of long-term care so that we have an understanding of why long-term care exists in our communities. So why is the need? Why do we have this need for long-term care? Families seek care for their loved ones for a wide variety of reasons. Usually it begins with a decline in functional and cognitive status. Most residents need assistance from staff with their activities of daily living. They need assistance with bathing, overall grooming, hydration and nutrition assistance. They might need help with ambulation. So there's a physical decline that exists. There's also the need for long-term care after a hospitalization stay. Most residents usually are not able to return home right after they've been admitted in an acute care environment. So the need for long-term care setting, either for short-term or long-term stay, is needed. There's also the necessity for a specialized environment. Some of our residents need care for dementia, Alzheimer's related disorders. Some need specific and very specialized care for HIV/AIDS management, and others might need help with neurological problems. And there are others who might need care from a pediatric perspective. We don't have a lot of pediatric children related long-term care environments, but they do exist. So there are multiple dimensions and principles of long-term care. There are a minimum of 10 characteristics that you'll need to know about, a wide variety of services that fit the needs of our ever-growing and diverse population of residents and patients in our care. And to meet a wide variety of these needs, some of the services would include, the primary one is medical care. Residents would need custodial primary medical care and nursing and rehab services on an ongoing basis following hospitalization during chronic conditions and comorbidities. That means their disease process as it develops, maybe from cancer, from congestive heart failure, beginning with hypertension or kidney failure. They may be declining in functional status, and our goal is to make sure we are restoring their functional status. There are mental health needs. We have a wide variety of psychiatric and dementia-related disorders and programs that help to meet the needs for those struggling with Alzheimer's and, again, dementia-type diagnosis. We have some residents who struggle with needs from depressive disorders, anxiety disorders, and also some psychiatric disorders as well. It's very common in the long-term care environment. As some residents age, it is quite common for them to decline with mental health challenges. So you'll find with a lot of your residents in future facilities that disease processes from a mental health perspective, that it's very, very common. The need also for social services exists on a wide variety of service needs for our residents. The need for counseling, the need for emotional support, sometimes spiritual support, being connected with family and attempting to locate family. There are a wide variety of social service needs that exist, and that's very important in the long-term care community. Other services, supportive housing, it helps for those who are lacking in independence. There's also the need for hospice and palliative care, which we'll discuss more about that in resident care management. But there is a need for some of our residents and patients to enter into palliative care services. Individualized services are very important because we want to make sure that our residents, we are identifying their specific needs and that we're working to identify those needs through the assessment process, through the care plan, goals, and plan of care. We want to make sure that all of our disciplines are coming together to help establish goals. And these goals, as the interdisciplinary teams meet, they meet together with our residents to establish goals. Once those goals are hopefully achieved, then we reevaluate and establish new goals as well. The goal is to have a well-coordinated total plan of care that helps to meet an individual's needs. Our residents are not, we don't deliver care from a cookie cutter perspective. We want to make sure that we're doing it directly to meet the needs of each specific individual.